Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide an update on COVID-19 for the Appalachian Highlands for the week of August 2nd, 2020. As I've pointed out before, if you follow week over week progressions in the number of deaths in the United States, we were slowing down pretty nicely and then have been picking back up again, such that over the past couple of weeks, we've been running at about 5% a week increase over the preceding week. We were seeing pretty much the same pattern in Virginia, with it slowing down pretty nicely until this last week. So we have to keep an eye on this, but it looks like what's happening is some parts of Virginia that weren't previously affected are now being impacted. In Virginia, if you look at the number of cases, it grew pretty quickly and then slowed down, but now appears to be going again. And the same is true with deaths. They grew quickly, slowed down, and now appear to be picking back up. So again, probably what's happening in Virginia is some of the major metropolitan areas were hit first, and now it's spreading into other parts of the state. This pattern in Tennessee has been all over the map, though. We've been up and down, not really slowing down much at all. If you look at the pattern, it looks like we're sort of leveling off around 10%. 10% is really pretty significant growth rate. If you think about it, if you had 100 deaths one week, you're going to have 110 the next, 121 the next, 133 the next, and you'll double the number of deaths in less than 2 months. So 10% growth rate is pretty concerning. And what you can see is in the early part of the pandemic, we were slow, and then we've been picking up in terms of cases. But in terms of deaths, we've been progressively increasing over time. The same is true here in the Appalachian Highlands for both hospitalizations and new cases. You can see the steady increase over time in terms of total cases. Again, same pattern. This is a chart that simplifies it and just looks at the cumulative number of cases, and you can see again, we've been inexorably growing. Now that we've been watching it long enough, I've been able to create this chart which shows you the number of deaths in our region by week. And what you can see is it was growing pretty quickly, then seemed to be slowing down a little bit, and has now been picking back up, and we've had over 300 deaths in our region and over 22,000 confirmed cases. It looks very similar to the pattern overall in Tennessee in terms of the growth rate. A moment ago, I showed you the decreasing growth rate in Tennessee, where it's sort of leveling off around 10%. And I pointed out how 10% growth rate is not a good thing to see, because it means you're going to double in less than 2 months. In our region, we sort of looked like we were going to level off at 5% and now been increasing. So I think what we're really seeing is the pandemic is now hitting our region for the first time, and we're seeing that early growth rate that unfortunately we've seen in most other places. Some people will always ask the question, well, are we doing something wrong? And the answer is no, not really. I think what we're seeing is that we're seeing the epidemic hitting here now. When we locked down, shut down in early March, it would probably have been better if we had waited a while. But a lot of those things you don't know until after the fact. But what's really important now is we do all the things that we know we need to do, right? We need to minimize meetings. If we don't have to have them, we shouldn't have them. If we do meet with other people, we should wear masks. We should stay apart from them and be associated with them as brief amount of time as possible, practice good hygiene, cooperate with the health department, all those other things we know we need to do. We are in the midst of the beginning, what looks like an explosive part of this pandemic. Hopefully it'll start leveling off soon, as we've seen in other places. But until then, it's time to stay the course. Be safe, be smart. Tennessee's had over 100,000 cases and over 1,000 deaths. Tennessee's had less cases, but about twice as many deaths, reflecting that Tennessee is probably doing more testing. In our region, as I mentioned, has had 22,000 cases and 300 deaths. There's a great deal more information on COVID-19 on our college website. If you go to this icon and click on it, you'll find all sorts of short videos. If you have any specific questions, please let me know. I'd be happy to try to find an answer for you. Thank you very much.